Wearables and remote patient monitoring are no longer futuristic concepts. They are rapidly becoming foundational elements of healthcare in the United States. Over the past decade, the convergence of digital technology, mobile connectivity, and data analytics has transformed how health is monitored, managed, and understood. What once required frequent in-person visits to clinics or hospitals can now, in many cases, be accomplished continuously and remotely, bringing care closer to where people live, work, and move through their daily lives. This shift is reshaping the relationship between patients, clinicians, and the healthcare system as a whole. At its simplest level, wearable technology refers to electronic devices that can be worn on the body, such as smartwatches, fitness bands, biosensors, and smart clothing. These devices collect physiological and behavioral data, including heart rate, physical activity, sleep patterns, oxygen saturation, and in some cases, electrocardiogram readings or blood glucose levels. Remote patient monitoring builds on this data by transmitting it securely to healthcare providers, where it can be reviewed, analyzed, and used to guide clinical decisions. Together, wearables and remote monitoring create a continuous stream of health information that extends far beyond the walls of hospitals and clinics. For the U.S. healthcare system, which has traditionally been reactive and episodic, this continuous model represents a major shift. Instead of relying on snapshots of a patient's health taken during office visits, clinicians can now observe trends over time. This is particularly important for managing chronic diseases such as diabetes, hypertension, heart failure, and chronic obstructive pulmonary disease, which account for a significant portion of healthcare spending in the United States. With remote monitoring, subtle changes in a patient's condition can be detected early, often before symptoms become severe enough to require emergency care or hospitalization. Consider cardiovascular health, an area where wearables have already made a substantial impact. Many consumer-grade smartwatches approved for medical use can detect irregular heart rhythms, such as atrial fibrillation, and alert users to seek medical attention. In a country where heart disease remains the leading cause of death, early detection of arrhythmias can be life-saving. Remote monitoring programs allow cardiologists to receive these alerts and follow up promptly, sometimes preventing strokes or other serious complications. This represents a shift from reactive intervention to proactive prevention, which is a central goal of modern healthcare reform, and the U.S. diabetes management offers another powerful example. Continuous glucose monitors, worn on the body and connected to smartphones or insulin pumps, provide real-time glucose readings throughout the day and night. For millions of Americans living with diabetes, this technology reduces the burden of frequent finger stick testing and offers better insight into how diet, exercise, stress, and medication affect blood sugar levels. When integrated into remote patient monitoring programs, clinicians can review glucose trends, adjust treatment plans, and provide timely guidance without requiring frequent office visits. This not only improves glycemic control, but also enhances quality of life for patients. Wearables and remote monitoring are also playing a growing role in post-acute care and recovery. After surgery or hospitalization, patients are often at risk of complications once they return home. Remote monitoring devices can track vital signs, mobility, and adherence to rehabilitation protocols, allowing care teams to identify warning signs early. In the U.S., where hospital readmissions are costly and closely monitored by payers such as Medicare, reducing avoidable readmissions is a major priority. Remote monitoring has shown promise in supporting smoother transitions from hospital to home and improving recovery outcomes. The COVID-19 pandemic accelerated the adoption of wearables and remote patient monitoring across the United States. As in-person visits became more difficult or risky, healthcare providers turned to digital tools to maintain continuity of care. Patients became more comfortable using technology to share health data, and regulators expanded reimbursement and flexibility for remote care. This period demonstrated that remote monitoring is not just a convenience but a critical capability for maintaining access to care during crises. Many of the policies and practices adopted during the pandemic have continued, further embedding these technologies into routine care. From a patient perspective, wearables and remote monitoring offer greater engagement and empowerment. Individuals can see their own health data in real time, which can motivate healthier behaviors and foster a sense of ownership over their well-being. In the U.S., tool, where patient engagement is increasingly linked to outcomes and satisfaction, this transparency is significant. Patients who understand their data are often better prepared to have meaningful conversations with their healthcare providers and to participate actively in shared decision-making. However, the widespread use of wearables and remote patient monitoring also raises important challenges and considerations. Data privacy and security are among the most prominent concerns. These devices collect sensitive personal health information, and ensuring that data are protected in compliance with regulations such as the health insurance portability. Healthcare organizations and technology companies must invest in robust cybersecurity measures and be transparent about how data are collected, stored, and used. Trust is fundamental. Without it, patients may be reluctant to participate in remote monitoring programs. Another critical issue is data overload. Wearables can generate enormous volumes of data, and not all of it is clinically meaningful. For clinicians already facing time constraints and burnout, the challenge lies in filtering and interpreting this information efficiently. In the U.S. healthcare system, where clinician workload is a persistent concern, successful remote monitoring programs rely on intelligent data analytics, automated alerts, and care teams that can respond appropriately without overwhelming individual providers. The goal is to deliver the right information to the right person at the right time. Equity and access are also central to the conversation. While wearables and remote monitoring have the potential to expand access to care, they may also deepen disparities if certain populations lack access to devices, reliable internet connectivity, or digital literacy. Rural communities, low-income households, and older adults may face barriers to adoption. In the United States, addressing these disparities requires thoughtful policy design, reimbursement models that support device access, and education initiatives that help patients use technology effectively. Without these efforts, the benefits of remote monitoring may not be evenly distributed. Reimbursement and payment models significantly influence adoption in the U.S. healthcare system. Historically, reimbursement favored in-person visits and procedures, making it difficult to sustain remote monitoring programs. In recent years, however, Medicare and other payers have introduced reimbursement codes specifically for remote patient monitoring services. These changes signal recognition of the value of continuous preventive care. As the U.S. continues its gradual shift toward value-based care, wearables and remote monitoring align well with goals of improving outcomes while controlling costs. Clinician training and workflow integration are equally important. Technology alone does not improve care unless it is seamlessly incorporated into clinical practice. Healthcare organizations must invest in training clinicians to interpret wearable data, communicate effectively with patients about remote monitoring, and adjust care plans accordingly. For many providers in the United States, this represents a cultural change, moving from episodic encounters to ongoing digital relationships with patients. When done well, this can strengthen continuity of care and deepen patient-provider trust. Looking to the future, advances in sensor technology, artificial intelligence, and connectivity are likely to expand the capabilities of wearables and remote patient monitoring even further. Emerging devices may monitor additional biomarkers, such as hydration levels, stress indicators, or early signs of infection. AI-driven analytics can help predict health events before they occur, enabling truly preventive care. In the context of the U.S. healthcare system, these innovations hold promise for addressing some of the most pressing challenges, including an aging population, workforce shortages, and rising costs. In closing, wearables and remote patient monitoring represent a powerful evolution in how healthcare is delivered in the United States. They move care beyond the clinic, empower patients with information, and enable clinicians to act earlier and more effectively. While challenges related to privacy, equity, and integration remain, the momentum behind these technologies is strong. As policies, practices, and technologies continue to mature, wearables and remote monitoring have the potential to make healthcare more proactive, personalized, and accessible. The task ahead is to ensure that this transformation is guided by a commitment to quality, fairness, and the fundamental goal of improving health for all Americans. Quote,